Hey guys, so today I wanted to share a few tips for someone who is maybe just new to being a CNA or new to the medical field or new to patient care in general. I just wanted to share some tips that I found helpful as a shy person or someone who might be timid timid about like approaching patients or residents for the first time and kind of dealing with how you get over that or how you deal with it, because it might take a while for you to totally get over that feeling, to be honest, and it might vary from person to person. So I've always been sort of a shy person, especially when I'm first getting to know someone. And so when you work in the medical field as a CNA, you're obviously interacting with a lot of different people on a day-to-day basis. And maybe not so much in nursing home settings because a lot of those are there for long-term care. But if you are like in acute care or in the hospital, then it's a little bit different because you don't really have as much time with these people to form a bond or to really get to know them and what they like and things like that. So, what I suggest is even though it might feel uncomfortable or strange or awkward when you're first introducing yourself to someone, make sure that you go into the patient's room and introduce yourself. Now, I have found this to be especially true when you're dealing with people who have Alzheimer's and dementia. I would usually introduce myself pretty much every time I went into their room to do care. Um, you know, some of them, they get used to you. Um, I feel like it's definitely more important in Alzheimer's dementia because they don't always remember who you are, and that's just part of their disease. So, with people who do not have this disease, like if you were in the hospital setting, they are more likely to remember who you are, but it's still important to always, let them know what's going to happen and all of that stuff. Follow the standard protocol for, your CNA duties. Um, but, I just think it's important to introduce yourself at the beginning of your shift. I always did this to anybody whenever I floated at the nursing home up to like the more acute level of the nursing home. Um, I would always go in with the CNA who's going off shift and I would introduce myself and I would let them know, that the other CNA was getting off for the night. And so they would be leaving and I would be taking care of them for the night or whatever. So I feel like introducing yourself is definitely important. I would also say, just being kind and pleasant. Obviously there's going to be bad days regardless of where you work, and everybody has bad days. I get that, but do not bring that into your workplace when you're dealing with patients or especially when you're dealing with Alzheimer's residents. Um, but patients can tell when you have when you're having a bad day, when you have a negative attitude or a negative outlook, they can just tell. You kind of give off these vibes, and it works out so much better for you if you don't have that negativity just hanging around you like a black cloud, because you're able to interact with them easily or more easily. It's a little bit easier to have a back and forth conversation. I definitely think that one of the things that I've learned since I became a CNA last year was that, I learned how to be able to have that back and forth conversation with someone who I didn't know, which was very awkward for me because, I am a shy person. I'm quiet. I keep to myself, and I don't necessarily go out of my way to talk to a lot of people who I don't know. So, when you're dealing with patient care and things like that, it's important for you to be pleasant, be kind, be respectful. Obviously, you have respect and dignity and all those rights and things that you have to um, do just as your duties as a CNA legally. And, I just feel like it's important to not let your shyness kind of block or prevent you from being the best CNA that you can be. like I said, I definitely, even throughout CNA training, when we went on our clinicals, I was always very shy. I kind of hung back and I watched everything that was going on, but I was not the first one to volunteer for things, to volunteer for like giving people showers or, you know, bed baths or changing them. I never really volunteered. I just let the instructor pick, me to do those things. Um, and I would say it is so much easier if you just volunteer for those things. If you really want to make a career for yourself in the medical field, you need to step up and you need to volunteer to do things that make you feel uncomfortable. You need to step outside of your comfort zone. And, as hard as it may be, because like I said, I'm definitely shy, but I've had to do this myself. Step outside of your comfort zone and do the things that make you feel uncomfortable, because it makes you so much better as an employee, as a caregiver, as a CNA, as a nursing student, whatever you are, it makes you so much better as a person, as an individual, as a professional, if you are able to do that and overcome whatever is holding you back. And then I feel like from there, you'll be able to go on to bigger and better things and focus on learning more and just getting more out of your professional experience altogether. So those are just a few of my tips. If you'd like, I can make another video about some other tips that I have for new CNAs and all of that stuff. If you liked, or if you like my nursing CNA focused videos more than just my other videos, definitely let me know and I can try to pull some more of these types of videos together for you, because I definitely have things that I feel like should be said and need to be mentioned and are important, especially for new CNAs to take into consideration. So with that being said, that's all I have for right now. I hope you guys are having a great day and I will see you guys again soon.